The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, and producer of this program, along with my co-host today, Otto Los and Paula Ewell. Paul and I work together at the Town of North Hempstead Services for the Aging Project Independence, where I'm the Director of Senior Citizen Affairs and Paul is the Deputy Commissioner. And Otto Los might as well be part of the staff at this point. He's a volunteer supporter, friend, an all-around A-plus senior, I believe is the going introduction. This morning, we are talking with friend of the show, the Medicare guru himself, Barry Klitsberg, who is the Assistant Program Coordinator at Nassau County HIICAP program at Family and Children's Association. We're going to talk all about Medicare 2025 updates. And I have to say, this is the 8th appearance of Barry Klitsberg on our program. Yeah. And, you know, it's just really so great, Barry. Your knowledge of something so incredibly complicated, and just prior to the show starting, we were saying that this year is extra complicated. So who better to help clarify some of that, Barry, than you? So just tell us what to expect. I know Otto is browsing over all of his questions. I'm sure Otto has a lot.
Reality is that every year there are new people going on to Medicare. And when you first go on to Medicare, it's really complicated. It shouldn't be, but it is, in my opinion. And then people like me who've been on Medicare for a couple of years, it changes. It shouldn't change, but it does. It changes every year, no matter how you slice it. So Barry has the knowledge to transition newcomers, if you will, and to help those who've been on it for a while. Because things change. There's nothing constant.
You're right. And one of the advantages of having so many baby boomers turning 65 is that they work with computers now, so they tend to be a little more tech oriented. Mm-hmm. So if I say, go onto the website and I can walk you through it, and I'll have people turn on the computer and go through all of the processes while I'm on the phone saying, see the screen, click on this, click on that, and we can get them through the application process or enrolling in a drug plan or an Advantage plan or even a Medigap, which is a supplement to Medicare. We help them with all of that. So, and then people who are not quite so tech savvy, like myself, once you see it, it actually kind of makes sense. But it can be intimidating. That's a big factor. Yeah. The intimidation factor of the computer. I mean, I'm looking at this box in front of me with all the keys. And I mean, if I had to do something besides play solitaire, I'd be lost.
Well, maybe a good place to start is just the basic foundation. You know, like there's Medicare, people hear terms, Medicare gaps, supplemental, is there a difference? Advantage, drug plan.
All right, I'm going to give you a quick 101.
There you go.
All right, Medicare has two basic parts, A and B. A is hospital insurance, which covers you for an inpatient stay in a hospital or rehab after hospitalization. It can cover the rehab. It can cover home health care after hospitalization. That's skilled care, not an aid. If you need a physical, speech, or occupational therapist or a skilled nurse periodically to come for wound care, that's covered. It also, Medicare hospital insurance also covers hospice care. Hospice is a vastly underutilized benefit for people who've been diagnosed with a terminal illness. 6 months left to live is the estimate. They don't terminate you or your benefit after 6 months, but that's the program. And hospice is for pain management and symptom relief. When you're saying basically, I'm giving up active treatment to cure my disease. It's terminal. We all understand that. I want to live the rest of my days in comfort. The medical insurance, which is Part B, covers doctors in the hospital or outside of the hospital, lab tests, diagnostic tests, MRIs, CAT scans, things like that, out of the hospital, durable medical equipment. So there are specific benefits that offers. It also can cover home health care if you weren't in the hospital. If you haven't been in the hospital, but you need physical therapy, let's say you had an outpatient procedure. Nowadays, they do hip replacement, send you home the same day. They have a therapist come, evaluate you, then with the doctor's consultation, they set up a plan of care. If you haven't been admitted, Part B covers that, and that's 80% of the approved charge. Now, to get to your point about the other stuff, Part D is drug plans, which there are 12 plans in New York State for next year, costs ranging from $38.70 a month to $170 a month.
Wow.
I have a summary of the plans, but when people call, and I know you know this, we will ask the person for their drug. What drugs do you take? The strength, the quantity you get every month, and what's your pharmacy? We will then send them the top 3 plans based on overall cost. So they can then make a choice. Usually it's based on cost.
This is the formulary thing you hear
Well,
about?
the formulary is a list of approved drugs.
Right,
The formulary is about 8 inches thick.
right.
So that's why people call and say, can I get a formulary? And I'll say, do you have $1,000 for postage? But send me the drugs you take.
Right.
Because people say, what if my needs change? And I get this all the
Yeah.
time. We only know what we know.
Yeah.
The plan will probably cover new drugs, but we don't know what you're gonna take, the strength. So we can't put that in. We
It's
can,
on-
but it's not gonna be accurate.
Right.
And also, is your pharmacy preferred? Is it in the network? It lowers the cost.
Yeah, I just went on, I think WellCare has a, where you can search
Mhm,
within the formulary
Right.
and see what tier, which is another term,
Right, yeah.
what tier the drug is in. 1, 2, 3, 4,
There's 5, which is
5,
kind of specialty drugs.
right. And, and each one of them has a tag connected to it that's connected to dollars.
Right.
Right.
But again, you need to know which plan you're in. WellCare, like you mentioned, has 2 or 3 different plans. I have
Right.
my list here. WellCare has 3 different plans, 3 different premiums, 3 different sets of benefits. So again, we would need more specific information, which we're happy to walk people through to get this. And again, if they're sitting at their computer and I have the time, say, let's go through each drug and your pharmacy, and then you're gonna see what I see. And you can print it out, or they could just click on the enroll button.
Yeah. Wow.
And
That's Part D. Now, Part C are Advantage plans.
Right.
All right, they're different than Medigap, which are supplements. Medigaps cover the Medicare cost share, the 20%, all or part, your hospital deductible, and they don't cover drugs, they don't cover vision, dental, and hearing. Advantage plans can. There are HMOs, health maintenance organizations, and PPOs, preferred provider organizations. If you live on a farm, there's the EIEIO plan.
I was about to write that down. Sorry.
Wait, that's a new plan.
That's a new plan, right? Old McDonald invented it.
Right.
But the HMOs, you must use the providers in the network unless it's an emergency. And you normally, not always, but normally need a referral to see a specialist. Right? But they do cover vision, dental, hearing, different levels. Again, we go to the website. Each plan, when you click on more detail, you get all of the dental benefit.
So like the Advantage plan is a public corporation, if you will, a version of Part A, B, and D.
They're private companies,
Right, and they're taking over A, B, and D.
right?
You don't have A, B, and D anymore.
Well, technically you do, but you're getting your health care and your benefits through the plan.
Right,
So what I tell people, if you sign up for an Advantage plan because you like the low premium, or you want the vision or dental or hearing benefit, which for a lot of people, that's why like 40 some odd % people in Nassau have some kind of Advantage plan. If that's important to you and you find a doctor that's in your network to lower the cost, that could work for you. Now with a PPO, you can go out of the network. So if you go out of network, you still have your copays, but they're a little higher than in network.
Okay.
And you don't need a referral to see a specialist. So there's a little more flexibility. And again, most of them have some variation of vision, dental, and hearing. And the premiums are lower than the Medigap plans, which, like I said, cover what Medicare covers but the 20%. And with the Medicaps, there's no network. You can see any doctor or hospital in the country or the territories that takes Medicare.
Right. Me personally, I find, and this is an opinion only, we're not
Mhm.
selling anything here. The Medigap is, to me, more cut and dry, and I don't like the fuzz that goes around the Advantage plan, because there are no rules. Like with the Medicare, you've pointed out to us, there are plans with letters, and every plan is the same, no matter what company you deal with.
Within that band, like Plan
Right.
G, for
Right,
example,
Right.
which is has a very extensive set of benefits. No matter who sells Plan G, by law, the benefits are the same. So if you call our office, we'll send you a list, or we'll email you the list of the Medigap plans with the most current information that we have. One side of the paper are the standard benefits. On the other side is who sells them. So if you take a Medigap plan, you know what you're going to pay up front. And with Medigap, there's, like I said, there's no network. Any provider that takes Medicare, your Medigap will automatically cover the share that they're supposed to cover. And with Medigap, there's no enrollment season in New York State. You can switch anytime. And it's effective the first day of the following month. It's called continuous open enrollment.
So this enrollment period we're talking about, October 15th to December 7th, doesn't really apply to Medigap?
Doesn't apply to Medigap. It applies to drug plans
Right,
and Medicare Advantage.
right.
And if
okay.
you're in a Medicare Advantage plan and you go past December 7, there's a second enrollment period. It's called the Medicare Advantage open enrollment period, which runs January through the end of March, where if you're in an enrollment, an Advantage plan, you can switch to a different plan, or you can drop it and go back to Medicare.
Right.
But you can't sign up for a new plan if you don't have one, but you can switch or drop.
Yeah, one of the things personally I don't like about the Advantage plan is it's a marketing business, if you will, because it's private corporations that are selling this stuff. And you really, everybody, it's like selling cars, like my car is better than your car because it does this. And I find it very difficult to compare Advantage plans.
That's why we put together a sheet that we have of
Right,
the HMOs in Nassau and a separate sheet of PPOs with the summary of the benefits. But it doesn't have all the detail because it's 16 plans on 2 pieces of paper. But at least gives you a heads up.
Yeah, that's great.
And we have no affiliation with insurance companies, agents, or brokers. We're funded through the county. Actually, it's federal money. So there's no financial stake in whatever a person does. And our program, and this is defined in the law, its goal is to empower people with Medicare, with the so they have the information to make informed choices. So whatever you do, you don't like your plan, you want to switch, I'll help you. I'll guide you through it, or my office will. We have some very good counselors and some good volunteers. We'll help you pick the plan that works best for you.
at no cost, and you're not selling anything,
I
which
don't
is very
sell anything,
important.
and
Which,
I have-
and that's, it's
we
such a gem because,
Yeah.
Yeah.
we talk about this all the time on the
Yeah.
show, having someone who's not trying to sell you something is so rare,
Mhm.
that you can just get an honest opinion that someone's really trying to work with you, really. And I think it's a great time to give the phone number. So how could people get in touch with you, Barry?
My
and-
phone number is 516-485-3754. That's our hotline. Either you'll get me, because it rings at my desk, or if I'm not in, you'll get another counselor. If you get voicemail, we will call you back. I have severe OCD when it comes to returning calls, even on days when I'm not working.
I can vouch for that.
Right.
And as someone who, loves when people respond quickly, Barry always gets back to me very fast. So thank
Yeah,
you, Barry, for that
Sure,
too.
but that's our number, and I'm going to repeat it during the program,
Yes.
but call us. Somebody's in the office 5 days a week. If you call late in the day, you may not reach anybody. If you call and we're on the phone with another client, leave a message. We will call you back.
And Barry, if people want to make an appointment with you, is there something they come to the office? You do it on the phone? Like, how does that work?
People should call and make an appointment.
call and make
If they
an
actually, if they absolutely must see us,
Mhm.
we're in Garden City. So people can call and make an appointment. I always stress an appointment because if I'm out of the office doing an event,
Right.
Or if I have another client, if you just come in, I may not be able to see you. And if I'm the only person in that day, then you may be sent home. Sometimes if you call and say, I need an appointment, I'll say, all right, but maybe we can do this over the phone. If you want one-on-one counseling, which we can do, let's try to do it over the phone first. I'm going to mail you the material, so you're looking at the same thing I am. This is what you need to have ready when we talk. And if you have a computer, go online and I'll walk you through everything. And I can save them the trip. We're in Garden City, near Hofstra. We're not far.
Great.
What's interesting is also like newcomers, if you will, depends on what your situation is in terms of where you worked before. Is there any insurance coming along with that or not? Like in my world, the company said, okay, if you use VIA benefits, you will get X dollars towards your medical insurance. So you have to go through them. And we're told 1,000 times, you go not through VIA benefits and you go directly to United Healthcare or whatever, you're going to be in trouble as far as your benefit goes. So it's very important to also pay attention to, where your starting point is.
I always tell people, you're going to, especially this time of year, you're going to get a ton of mail. Most of it's marketing. But things to look for, something from Medicare, your current health plan, Social Security. They will always send you the stuff, hard copy mail, snail mail. They won't call you, they won't email you unless you tell them to. But read your mail, and if you have an employer retirement health benefit, that's also very important. Because if you want to switch, I need to know like how much you're currently paying. Is it a better deal than what Medicare would offer? You still have to take Medicare Part A and B, but you may get your drug coverage through them. You may get a supplement through them, and that might be better than or cheaper than what you would have through Medicare.
Well, after the break, we will continue talking with Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, all about Medicare 2025 updates. Get your pens ready. You're listening to Project Independence and You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with co-hosts Paula Ewell and Otto Lowe's. We're going to continue talking with Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, aka the Medicare Guru, how I refer to him, about Medicare 2025 updates. So let's jump right back in, Barry.
Otto's last question was going to lead me into, when do people apply? When you retire? When you're 65,
Yeah, right.
people are eligible for Medicare when they're 65 or getting disability from Social Security for 2 years, or have Lou Gehrig disease, which is the following month after diagnosis, or permanent kidney failure requiring a transplant or dialysis. It's called end-stage renal disease, but I just prefer plain English, permanent kidney failure. That's you get after 3 months after your diagnosis. If you're collecting Social Security retirement benefits before 65, Medicare, you will automatically get your card in the mail. You don't have to apply. Because Social Security issues the cards, they know how old you are.
Okay.
If you're getting disability, they know how long you've been collecting disability. They will automatically send you the card. Otherwise, you have to apply.
Now, you mentioned several disabilities, all right? Couple scenarios. Suppose you have a pre-existing condition, or during the year that went on, you wound up with Parkinson's or dementia or a stroke. What does that do in terms of getting coverage, if you will?
Medicare doesn't care.
Okay, what about Medigap or Advantage?
Medigap can in certain instances. It's not going to happen, especially in New York. But if you've had other insurance and 63 days don't pass, you don't have a lapse in your other coverage, there's no exclusion for pre-existing condition.
Okay.
So for most people, that's moot. Okay, I would say for 99% of people, it's really not an issue. If you retire and you had other insurance or Medicaid or an Advantage plan and you want to switch, those are all forms of creditable coverage, which then eliminates the pre-existing condition exclusion.
So like, okay, now
Or VA.
you're a senior and you get on Medicare, you're 65, everything is hunky-dory. And then all of a sudden you're 75 and it's not so hunky-dory anymore. Maybe you had a stroke or whatever. Does that put you in danger of not being covered?
No, especially in New York, because it's called community rating. There's no underwriting. They can't charge you a higher premium for your age. It's called age attainment, which
Right.
happens in some states. They
It's
can't charge,
happening to me. I'm attaining.
not with
age.
Medicare.
No,
Not
I'm
with
saying
Medigap.
I'm attaining age.
A lot.
Oh, yeah, I mean,
It's an old-fashioned way.
70's in my rearview mirror also. So, but they can't charge you more. And if you develop a condition and you have coverage, they can't drop you and they can't charge you a higher rate, and they cannot exclude your treatment from coverage.
Would that be a bad time to switch coverage? Like, in other words, you're on a Medigap policy. Is that the time to stick with the company?
Then that's the time to ask.
Yeah,
Let me give you an example about that. Let's say you have Plan N, which is a good Medigap plan,
mhm,
but you have a $20 copay when you go to the doctor, up to $20. Let's say you go to the doctor 4 or 6 times a year, but your doctor said, or you think you need mental health therapy, which is weekly.
mhm.
All of a sudden, that $20 copay is going to add up to a higher amount. You might want to switch to the G plan, which has no co-insurance, no $20. Because if you look at the premium between G and N, and I'm not going to mention company names, but a popular plan, the difference in the premium is $780 a year. That's 39 $20 visits.
Right,
If you go once a week, all of a sudden, G is a better value.
right.
So again, that's why
But
people
that-
really need
that's
to
just
call.
Changing the letter of the plan.
Well, it changes the benefits of the plan
Benefits.
No, but
also.
what if you decide to change, you want to go from United Healthcare to Emblem?
You can do that.
And
anytime.
And this won't
No, no, because you've had that other creditable coverage up
Okay.
until whenever.
Okay,
63 days don't pass.
right.
So no, you're
So
fine.
that's important, frankly, because people shouldn't be afraid that they're going to lose their insurance.
And
No, and
again-
this is why you need to call. And that's, I think it's so complicated. I mean, the fact that you've been on here 8 years and every year I'm like, oh my gosh, this is, it's just so much information and it's complicated, right? And it's something, with this, which I think we just show with that example, it's such an individual kind of process. So what goes for you is not going to go for me, so I think the benefit of being able to sit down with someone and just kind of
Yeah.
really go through that, because
Yeah.
it saves you so much money.
Yeah.
I mean, it's
Time.
remarkable. Yeah, but
Time, yeah.
it's just stuff that you wouldn't even know. I think so many of us, oh, I'm just gonna keep like the status quo
Yeah.
and just, keep it going. It's easier. And then you look, I mean, when we've done these Medicare Part D programs, through
Gosh,
Project
yeah.
Independence, you see the amount of money that gets
Yeah.
saved. And it's just, I can't encourage people enough to call. It's just so wonderful.
And there's
Well-
another program, the 2 other programs that save seniors money on drugs. One is the New York State EPIC program,
Yeah.
Yeah.
elderly
Good.
pharmaceutical insurance coverage,
Yep.
which either has a deductible plan or a premium plan. The premium plan is very affordable for most people, and it covers you from day one. And it works with your Medicare drug plan or your Advantage plan for your drug coverage to lower the cost further. The premium plan covers you from day one. The deductible plan for higher income folks has no premium, it's free. But you have to meet a deductible
Mm.
based on your income. It's a
Mhm.
sliding scale.
You need a Part D, though?
Yes.
So this is a supplement to
It
Part
works
D.
with your Part D plan.
Right,
And if, one other thing, if you have Epic, you can make a once-a-year switch from your existing drug plan to a different plan if the plan isn't working.
Mhm.
Or if you have a Medicare Advantage plan that's not working for you. Let's say the doctor leaves the network and you want to switch to another plan. Well, if you get your drugs through that plan, that's your drug plan. You could switch once a year
Mm.
to a different Advantage plan that your doctor might be covered. So this happens often.
Yeah.
So Epic is a wonderful program to lower costs, and it's the get out of jail free card
Mhm.
for your drug plan. And one other thing, one of the programs called the Medicare Savings Program. This is a program for lower income folks, up to $2,355 a month in gross income. If your income is below that, and the only countable deduction for income is your Medicare MEDICARE plan, that's a deduction. But if your countable gross income is under $2,355 a month, you can apply for this benefit. It will pay your Medicare Part B premium, the $174.70 that comes out of your Social Security check. They will pay that for you.
Wow.
So your income goes up, and you get what's called extra help with your drugs, which either lowers or eliminates your Part D premium
Mhm.
and lowers your copayment by a lot, even if it's a brand name drug.
Mm.
You don't pay more than $11 or so.
Like the supplemental stuff, I've used quite a few times, actually, Good RX
Mhm.
during the year. You know, you get a price $300
Mhm.
and I go to Good RX for the same drug and it's $60.
That's a discount program. It's not insurance.
Yeah, how does that, I don't understand how that works. Like,
I
how-
think,
and
need-
has this new stuff impacted that?
no. You can't use both in most cases.
Mhm.
If you want to use one of those discount programs like Good RX or one of those substitutes, you can. And you just tell the pharmacy not to bill your Medicare drug plan for that drug because it won't work.
Mhm.
Yeah, that's what I've done,
That's right.
frankly.
And I tell
it's-
people this, I said, if you can get a better deal, go for it.
Right.
Yeah,
But keep some kind of insurance.
Right.
Because
Just
if
in
you don't
case.
have drug insurance at some point and
Yeah,
you
'cause
want
who
it,
knows, right?
you're gonna have a penalty and
Yeah.
it could be steep.
Hmm.
And I get this call a lot. People say, I never took prescription coverage because I didn't take any drugs. My answer to that, do you have fire insurance? Well, of course. Is your house on fire right now?
yeah,
Well, it's insurance.
Yeah, right.
You take it, you have it, you use it when you need it. If you don't need it, you're covered.
right. To me, it's such a jungle, you know,
It is.
pricing
Yeah,
of
of
drugs.
Which is why people should call me at
Right.
516
Yeah,
485-3754. Myself and the other counselors will talk to you in plain English and go through everything with you.
So Barry, when people call for counseling, are you going to tell them also about Epic and these other is that part of your
It
general?
depends on the conversation.
Okay.
If, again, sometimes we get calls from people with a high income who are paying a higher premium. I don't have to talk to them about Epic because I know they're not going to be eligible.
Right.
I don't talk to them about the extra help program
Right.
or the Medicare Savings Program. So it's tailored based on a conversation. I don't work off a script.
Yeah. 'Cause
I
I'm
talked to
thinking,
a
like,
person-
What should our social workers be saying? Like, if they're doing an assessment and they're talking about insurance, obviously we're going to make a referral
Right.
to talk to you, but for their understanding, like, who should they say? Well, Epic may work for you. Call Barry.
Yes, absolutely. If
yeah.
their income for an individual is under 75,000, or for a
75,000.
couple, it's 100,000,
Okay.
they can call. We have the application. I even brought one with me today.
Wonderful. So
You can
couple
t-
is 100,000.
Yes,
Yeah.
you can call and, you call, or just we'll mail you the application.
That's wonderful.
It's an
Okay.
easy form.
Because I think that's something in part of our
Assessment, right?
If you want if you want a bunch of these,
Yeah.
I'll send them to you.
Yeah,
Yeah.
yeah, I think that would be
I
great.
think the Medicare Savings Program application.
Yeah, that would
With
be
the
great.
instructions, there's nothing wrong with having information.
Right, yeah,
For your staff.
yeah,
And if
Yeah.
your staff wants, I'll come and talk to them
yeah,
and train
yeah,
them.
yeah.
you know, you bring up a point too, by the way, people should not be shy or whatnot about telling a social worker
Mhm.
or Barry what they make as income.
Right,
Most people, if you stay retired long enough,
Mhm.
you're going to be in this category.
Yeah.
One of them, sure.
Yeah.
Because when you start like 20 years ago,
Mhm.
you got a wonderful pension, wonderful this, wonderful that. And the next thing you know, 20 years later, it's not so wonderful anymore. And the number like for Enhanced Star
Yeah.
is up to 107,000,
Yeah.
100,000 for Epic.
Mhm.
There's a lot of people who
Right.
are in the 80s,
Right.
year-old bracket and 90,
Yeah.
don't get anywhere
Yeah.
near
Yeah.
that kind of income.
Well, people
Yeah.
call a lot, I need help. Okay, can we talk? What are you looking for?
Mhm.
And then after I go through my spiel about health insurance and healthcare, I'll say if there's other benefits or programs you need, I can refer you to somebody, an ISIP, Expanded In-Home
Right,
Services
right.
case manager
look
to
at.
go over that with you.
Yeah, that's what we're doing.
So again, we're all housed in
Oh,
the same
together, right,
area.
yeah.
So unless you're a stone and you don't listen to people when they talk, you don't know these programs.
Yeah, yeah.
Yeah.
Yeah,
It's just
So again, you're right, though. People are hesitant.
yeah.
I
Yeah, I
said,
mean-
I don't want Medicaid. I said, you might be eligible for
Community-
programs that they run,
Right,
Right.
like the Medicare Savings Program. Well, I don't want to go down to Medicaid. So you don't have to,
right,
but this is something
Right,
you
you can
worked
apply.
all your life.
right, yeah.
Yeah.
And
Paid
at this
into this.
point,
Right,
if at this point you think you might be eligible to save a couple of $100 a month,
yeah.
why not?
Why not? Yeah.
no, and I think
Yeah.
you just summed it up. And I know, working with seniors, and I think it's getting a little better,
Yeah.
as the years gone. But when you hear the word Medicaid,
Mhm.
it's like no, and
No.
you don't realize.
It's I don't want to take
It
charity.
has a
Right.
stigma.
Yeah. No, it does.
And
And
we
it's-
still hear,
it's
no,
so
other
important.
people,
They
they
need
think
it
they're
more,
taking
right.
from others.
Yeah.
Right.
Like to give it to someone
Yeah.
who needs it more than me.
I
And
mean,
we
it
hear that a
generally,
lot.
frankly, I talk to a fair number of people about Project Independence.
Yeah.
And I'll tell them, and I know they never follow up and they
Right.
never
Yeah.
call.
Well, people think it
and they
costs
think
money
it's
too.
like charity.
Oh,
And, it's
And
not
sometimes the
charity. It's
opposite.
people
No.
who are willing to guide you
no.
through
no,
tough
No, and that's why it's so
Yeah.
important to, have these, obviously our radio show and these programs where we're educating people because, Barry, then on it, you worked for all of this, and it's hard. Listen, no matter what age, I mean, we all know it's hard, monthly to pay for things. So if you're able to save money on one of these things and still get what you need, why
Why
not?
not?
Yeah, yeah, yeah.
It's really just so
Yeah,
important.
and like with the Enhanced Star, like someone might have asked about that 5 years ago and the number was different.
Yeah.
So they're like, oh, we're
Right.
not gonna ever be eligible. But
Yeah, I just
meanwhile-
heard the other day,
yeah,
it's up
she
to
said- yeah,
$107,000.
Yeah,
I can
and
tell
you
you
don't
that.
realize she said, I think it's every year, it
Yes, it
changes.
does.
I
So-
have no idea what people make, but I'll be willing to wager that 80% of the people make less than that are in 80 or above age bracket.
Yeah, yeah.
A year.
Yeah.
You Social Security, pension.
Right, yeah.
I guess IRAs come into it.
Mm-hmm.
I'm not
I
sure.
just got an email from Social Security yesterday. The cost of living adjustment is official. It's 2.5%.
Oh,
Yeah,
that's
right.
low. That's the lowest in a
That-
while,
yeah.
right? Yeah.
Yeah, it's.
And probably the
something.
cost of the drug
I'm gonna go.
supplement
right.
thing probably went up higher than that.
It probably did. In
So
most
you're
cases.
minus.
Yeah,
You're
I mean,
minus.
your Medicare Part B premium will go up too, but we don't have that yet.
Yeah.
Yeah.
When do you usually get that info?
No, November,
November.
sometime in November, we get
Yeah.
that. Now, there is a provision called the hold harmless provision. That if you have Medicare A and B,
Mhm.
which you do, and the Medicare premium goes up more than the dollar amount of the cost of living adjustment,
Mhm.
it's called hold harmless. Your Social Security cannot go down as a result,
Okay,
which causes confusion later
Yeah.
on if there's a bigger adjustment,
right,
but at least you're not going to get a reduction in your Social Security. That's illegal.
because of that, yeah.
That's a good thing.
Wow, it's so.
I mean, I know
complicated.
people frankly that just live on Social Security. I
Yeah.
mean,
Yeah.
Yeah.
It's not good.
No.
Yeah.
You
Yeah.
know.
It's a lot of people. It's a huge
Mhm.
Yeah.
proportion. It's just so complicated. My
And,
gosh,
and
Barry,
Social
really
Security
just impressive.
creeps up on people's lives very quickly.
Yeah.
When you
Yeah.
didn't think about it as you were going along,
Yeah.
maybe
yeah,
you're living hand to mouth,
Yeah,
during most of your adult
right,
life.
right,
And then you, all of a sudden, there you are,
right,
if there's any way you can prepare a little bit,
yeah.
it's a
worth
good
it.
idea.
Yeah,
Yeah, I worked for Social Security as part of my federal career. And I explained to people when you should take it, how much, and I give them examples with numbers.
Mhm.
If you want to take it before 66 or 67 now, it's going to be 67 full retirement age. What are the implications?
That's me,
And if you wait till you're 70, what are the implications?
right,
So we walk people through that.
I was in one of the first ones, I was 67, and you could take Social Security while you were working.
Yeah, they got rid of the retirement test.
Yeah,
is
which I
the
did.
earnings. Yeah, And they used to have, and they still have this formula, if you're not at retirement age and you start taking it, how much you lose based on your earnings. It's a 2-for-1. For every $2 above a next dollar limit, they withhold $1 in benefit. So you still might work and get some benefit, but you don't get every check for the year. They withhold some of them. But if you're still working, your check will go up every year, your base amount goes up automatically. So if you're working and what you make this year is more than you made in one of the 35 years they used in the computation, they substitute it. So you get more.
Yeah, that's all good.
Well, after the break, we will continue talking with Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, Medicare guru himself, about Medicare 2025 updates. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Paula Ewell and Otto Loos. We're going to jump right back in with Barry Klitsberg, the Assistant Program Coordinator at the Nassau County HIICAP Program, about Medicare 2025 updates and really anything else we could possibly ask Barry, because he's just such a wealth of knowledge. We're just going to keep him here all day. I think that's pretty much it. So let's get back into it, Barry.
During the break, Otto mentioned a couple of words under his breath, donut hole.
Don't tell Dan I said that.
Anyway, this year it's gone. It's been phased out over years. This year, there is no donut hole.
Yay.
If you hit what was called the coverage gap, now you're in the catastrophic area where the coverage is higher. But once you hit, and again, it's gone, so you wouldn't pay more than 25% of the cost of the drug, which is in the original Medicare drug law. So that's gone. And if you have Epic or extra help, your costs go down even more. One other thing to mention that's important, if you have a Medicare drug plan or an Advantage plan, and they do have a deductible, which you have to meet before they start covering your drugs, if you take inexpensive generic drugs, most plans will waive the deductible. So they start covering those,
Okay.
let's say Lipitor,
Mhm.
which is a atorvastatin,
Yeah.
or metformin, glucophage.
Mhm.
If you're taking those drugs, they will waive the deductible and start covering you from the beginning. If you take an expensive brand name drug, then they will charge the deductible. So, and if you have an Epic plan with the deductible, that will also help you with that. It could help you with that deductible. You
Yep.
meet the Medicare deductible, then the Epic deductible, and you don't pay more than $20 for a covered drug then.
Well, one of the things I did notice is I just got my change bulletin thing, and the premium went from $3.70 a month to $38.70. Yeah,
All of the plans have gone up.
yeah. I mean, that's a big, huge
Yeah,
increase,
jump,
but
right?
They
that's
were the
because
cheap-
of all the other stuff.
Right.
They're
They were,
gonna get it one way or another.
they were the cheapest plan by far.
Yeah, and I have no complaints about them.
And there are
We're
some
not
issues
promoting companies. but-
related to certain statutes, certain laws that were passed that capped the total amount of out-of-pocket expense. So the insurance companies realize that they may be losing at that end. So they have their actuaries and their analysts
Yeah. they could
figuring
do
out
it.
how can we make money
Right.
and still offer coverage.
Yeah.
So, and I'm not going to bash them. That's not my purpose. Again, information. But you have to look at the coverage. You call us, we'll walk you through the plan, or I'll send you a worksheet. And you give me the names of your drugs and your pharmacy, and I will then send you back the top 3 plans based on overall cost. And again, there's no charge for this, and
Yeah,
we,
it's just it really every time you say that, it's just because I just know how helpful that must be. I mean, the fact that to have someone, I mean, I don't clearly don't qualify, but I'm ready to call Barry myself. I'm going to put in my
Well,
appointment, but I think having that,
That's pretty good. You
Worksheet.
really think about applying for Medicare.
I mean, God, I'm sitting here like, my
Ahead of the
gosh,
game.
should I book an appointment with Barry now?
A lot of people call for their parents.
Yeah, no,
And
absolutely.
that half of my calls, I'm calling
Yeah.
for my mother, my uncle, my aunt, a relative. And I say, okay, we're not going to discuss personal information at this stage,
Mhm.
but I can give you general information. And then if they're in the room, all they have to do is say, yeah, he can talk for me.
Right.
And that's Social Security
Yeah.
uses the same thing with the Privacy Act.
Mm.
And so I won't accept an email with personal health information.
Mhm.
It comes snail mail, regular
Mhm.
mail, or over the phone.
Yeah.
For the do-it-yourself crowd,
Right.
all right, I believe you can go on Medicare.gov
Right.
and do some comparing.
And that's when I walk people through it. If they
Right.
have a computer and they're somewhat computer savvy, I say, go to the Medicare website.
Right.
I'm going on now. And you'll tell me, you'll answer my questions and you'll fill in the boxes with that information.
Mhm.
And then we'll ultimately get to the plans.
And they'll also do that for Medigap plans.
Medigap, see, you can't enroll online with Medigap. You can do it with drug plans or Advantage. Because of New York State insurance law, if you want a Medigap plan, you got to call an agent, a broker, or the company.
Yeah, I've been through that. And then you're on the phone for 45 minutes.
It
Because
varies.
they have a bunch of questions they have to ask you.
That's right.
Yeah. And
But
you
I
go
can't
through-
sign somebody up for Medigap. I could tell them, based on our discussion, what plan they should consider.
Right.
But
Right.
I can't endorse a company or a product.
Yeah.
But I'll say this plan probably works best for you. The number is on the Medigap sheet that I'm going to mail you.
Yeah, and the
Yeah,
norm
that's
is
great.
be prepared to be on the phone for 45 minutes.
Just like
because
Social
they have all
Security.
these things they have to ask.
I tell people,
And
put
you
your
have to
phone on
answer.
speaker.
Yeah.
So this way you
Right.
can hear when they come on, so you're not sitting at your table.
Yeah, that's the other part of it. You'd be ready to be on hold for a whole while.
Yeah,
Oh,
it
wow.
varies from company to company.
Yeah,
Yeah, but that's, again, people call me, like you said, we don't charge. So when they call us, oh, can I send you money? I said, no. If you want to donate to the organization, you talk to my financial person.
Right.
I don't take anything.
Yeah.
People send me candy, they send me some cookies or cake, and I just put it in the break room because I don't accept anything.
Yeah.
Because when I worked for the government, I learned the
Oh,
ethics
yeah.
rules,
Yeah.
and I actually live by them,
Yeah.
and I still do. I
you
don't
should
take
run a
anything.
few
Yeah.
classes on that.
have
That's his other
stories.
side
I have
hustle.
stories that I'll tell you after. No, we don't charge. We
Yeah.
can't charge because we're federally and
Mhm.
county and state funded.
Now, like, it's one of the things, like, to me, my biggest expenses that I've had is hearing aids,
Mhm.
Mhm.
mouth, very expensive. Anything
Yeah.
goes wrong,
Yeah.
Yeah.
it's like buying a Mercedes, it's a bad deal.
Right.
It's,
And then all the Advantage plans talk about, okay, you're gonna get vision, you're gonna get dental,
Mhm.
and you're gonna get everything. My question is there a way to really dig down into the ditch and find out,
Like what's
What will
actually
be
covered?
what does that really mean?
yes.
Like, if I go beyond 2 cleanings a year, am I gonna get?
We can tell you if the plan offers other dental services besides preventive.
Right,
They may offer checkups, cleanings, fluoride treatment, x-rays once or twice a year. You're right.
implant,
There are some plans, if you go through the details, you can see if they cover periodontic, endodontic, things like that, which are more expensive.
Yeah.
There may be
absolutely.
restrictions. You'd have to use the network of providers. But some plans do offer more benefits. And this is what I say earlier. Call us, we will get you the details.
right, the devil is in the
Details,
details.
yeah.
Absolutely.
Yeah.
No, and it's, as you said, it's based upon
Well, I
your
mean, in
individual
You don't
marketing,
needs,
expect you're
yeah.
gonna need it. That's the other thing.
Marketing wise, I get stuff in the mail
yeah, I bet.
every day,
Yeah.
Yeah,
probably.
so do I.
Get your vision, get your dental here,
Yeah.
get this here, and it sounds great. And then I say to myself, but there's a trade-off. First of all, how much am I really gonna get?
Mhm.
And then the limitations that Advantage plans might have, in terms of being out of network or having to get approval.
Yeah.
I have a friend who's going through this. He wound up having some problems this year, and it's been not good.
Yeah.
He's having to go through all kinds of getting approvals and this and that.
Yeah.
With the PPO, you don't need as many approvals. Like I
Right.
said, you don't need a referral to see a specialist like you do with an HMO. But again, like you said, the devil's in the details. You're going to see these commercials with Joe Namath or Jimmy Walker. Those are for
Yeah.
brokerage companies. Those are not insurance companies. And those are national commercials. So when they say, give us your zip code, I say, give me your county, because they're
Yeah,
county
yeah,
specific,
yeah.
these plans. And we'll look up. Give me, I'll take your zip code, because that's what the plan finder asks for. They're doing what I do.
Yeah.
They're looking at the different plans. The only difference is I'm not an agent. I'm not going to sell you something.
Mm.
And those commercials are that you see now around, either they're national or they're focused on the New York City market, which is more heavily densely populated with seniors. Many more companies, more competitive. So people in Nassau call, how come my brother-in-law who lives a mile away in Queens gets something and I can't get it? And I have to explain the county difference.
Wow.
Hmm.
That's really, yeah. I mean, like, these are all little things that, like, how would you know, unless
would
you talk to someone like Barry. And like, so if someone I mean, I know all these things have different enrollment plans, and you said about the Advantage, but let's say, I don't have an Advantage plan, and, the open enrollment period comes and goes, and now I have all this dental issues. So you only can now apply you can't do the January, March. Like, what do you do?
You can't sign up if you didn't have one.
if you didn't have, all right.
But if you have Epic
Mhm.
or Extra Help, which allows you to change your drug plan every quarter,
Mhm.
if you can change your drug plan and you sign up for a Medicare Advantage plan that covers drugs, that's in effect doing the same thing.
Gotcha.
So there, again, I don't expect anybody to know a lot of this stuff.
Mhm.
But if you call and say, I have a specific need, I need to find a plan. Well, either you buy a dental plan separately,
Mhm.
like Otto, who's got a
Right.
lot of money, or you find an Advantage plan that might work for you. And if you can switch, if you meet the requirements to switch your drug plan, you could sign up for an Advantage plan.
Now, you just said something that's going to ring another bell, all right? Is there such a thing as a dental plan that really works? And how do you go about it? I don't think we're in that.
Since they're not Medicare related,
Right, that's-
I can't really talk about independent drug plans or
Right.
vision plans.
Mm.
There are some that do work.
Mhm.
I mean, Delta Dental is affiliated with AARP, there's MetLife, there's a few other companies. And if you Google, and I
Yeah.
use Google a lot, if you Google dental plans for New York or for Nassau County,
Mhm.
you can, and if you're stubborn, you will come up with that information and you can get the details
Mhm.
from the plan online. But again, because they're not Medicare related, my knowledge is kind of limited.
Yeah, that's a whole nother world,
Yeah.
I'm sure.
Yeah.
You know, that,
Mhm.
to me, the dentist is the most expensive part of my healthcare,
Yeah.
you know?
Uh-huh.
Uh,
Yeah.
It seems like every time I go, they say, oh, yeah, you need, oh, I do.
I have,
I've had that for
I
like,
have a broken tooth that doesn't bother me, but I'm gonna have to go to the dentist eventually.
yeah,
Yeah.
well, I had a couple of broken teeth.
Yeah. Nobody likes going to the
Yeah.
dentist.
Yeah.
You know, when my era, skin, teeth, okay, brush your teeth.
Yeah, there wasn't too much
Yeah.
preventative
Right.
stuff.
That's
like
one of
that.
the reasons
Right.
Yeah.
that Medicare doesn't cover some of those benefits. It was based on, when the law was passed in 65, the standard Blue Cross Blue Shield plans back then with major medical. They didn't cover those things, so Medicare didn't put it in. Congress didn't put that in.
Right.
Oh, wow.
So, I mean, Medicare is great. It does a lot for a lot of people. And it's changed over the years, but it still is not
Yeah, I mean,
comprehensive
people in my
coverage.
generation
Mhm.
and older, they really didn't know how to take care of their skin
Right.
or
Mhm.
their
Yeah,
teeth.
it's different.
You
Yeah.
know,
Yeah.
it really was.
And their feet.
Yeah, right.
Podiatry is
Yes,
mostly not
yeah.
covered.
Feet have been
Yeah.
pretty lucky. I mean, I'm wearing shoes, you
Yeah.
can't tell,
My feet are a national disaster area.
Yeah.
but, well, that's
All right.
another topic.
Yes.
Right, right.
But anyway, but Medicare doesn't cover routine podiatry, routine dental,
Wow.
routine vision. Not if you have an illness or a disease of the eye, cataracts, glaucoma, anything like that, Medicare will cover the treatment and whatever you need. But routine care for your glasses,
Right.
for your prescription, not covered.
Yeah, glasses are like buying a car now.
Yeah.
They got
I know.
expensive.
Yeah.
Yeah.
Do you think like as over the, I mean, clearly Medicare every year changes. Is that something that eventually you think will be somehow more comprehensive in Medicare? Or
I
is it-
hope so. And every year, I know the last budget go around 2 years ago, they tried to put hearing benefits in
Right.
Medicare,
Yeah.
and Congress, in its infinite wisdom, took it out.
Yeah. That's awful.
I would love for more expansive vision and dental care,
Yeah.
because like you said, Otto, those are the big ticket items.
Yeah.
Yeah, they're out of pocket.
Yeah.
Yeah.
So if I would love for Medicare to cover more in that area.
Yeah.
Um,
And they create so much risk if they're not.
Well, that's what I'm
taken
saying.
care
I
of.
was thinking,
Like dental.
I was
affects your
just
cardiac
gonna say
health.
that, Paula.
Like bad,
Yeah.
if you can't get to a dentist, you
Yeah.
can afford it, it impacts your cardiac health.
Mhm.
Your vision,
Right.
you're more likely to fall.
Right.
And be,
Yep,
it costs more
exactly.
money in the long run
Yeah.
not to provide.
Yeah, I mean,
the
I know
service.
people who've had infection in
Yeah,
their mouth,
abscesses.
Yeah.
I mean,
could
it's
not
horrible.
get
Yeah.
heart surgery
Yeah.
Right, yeah,
because that
Yeah.
had to be cleared
Mhm.
up before they
Yeah.
would do it.
Yeah.
Yeah.
there's definitely an impact.
No,
So it
and
just would
my
make more
mom had the,
sense.
the same thing. There was like an abscess thing, and my mom had said on the show many times, it goes to cancer stuff, and that was something like they needed to make sure there
Yeah.
wasn't any kind of infection. So it's, I mean, look how directly that correlates care. It's
Yeah.
just, it's mind blowing to me that these things are.
These things are important.
Mm.
And the only dental work that's covered is surgery of the jawbone or related structures as a result of trauma and illness.
Not the teeth.
No.
Jawbone or related structures, not the teeth,
Right.
Wow.
trauma or illness.
Wow. Well,
That's-
that's why it's important, I guess, to find some kind of supplemental plan,
Find
to help-
or an
yeah,
advantage
right.
plan, go into the details, see
Yeah.
what they cover besides routine cleanings.
Well, the other part of it is which dentist can you go to when that
Oh, yeah.
takes place? I
Mhm.
mean, if you've been going to somebody for X years and they don't take Delta,
Mhm.
Yeah.
now you got to be willing to switch dentists.
And Barry, just give us your phone number one more time, because I want to make
Sure.
sure all of our
The
listeners are
number
jotting
for
that
our
down.
hotline to reach me or one of our trained counselors is 516-485-3754.
I'd like to, you can't read this, but through HIICAP, you can get lists that compare drug plans, that compare Medigap plans, that compare Advantage plans. And these little pieces of paper are worth their weight in gold.
Yeah, every year in October,
You know,
when the information goes live, we update all of the Advantage plans with the new benefits and costs.
I mean, this is work that you would have to do on your own.
Yeah.
You know,
Yeah.
Yeah, I tell people, I said, look at the list I'm sending you, especially for the Advantage plans. Talk to your doctors or their front office to see, are they participating in any of these networks? Then you're halfway home.
Yeah.
There's a thing that I read and I really don't know anything about it, that there's a star rating that's out there.
Those are customer satisfaction ratings.
Yeah, right.
If it's under 3, I wouldn't recommend it. And if you've had 3 years of under 3, they drop you. It's not listed on here. It's on the website. Because we used to include it and it would confuse people more than it helped them.
Okay.
Because there, again, it's customer satisfaction ratings. So you have to proactively answer a questionnaire. People who are dissatisfied tend to answer it.
Right. It's so
right.
true.
If you go to a
It
restaurant,
is.
if you go to a restaurant and you like the food, you're not going to complain about the food.
Right. Got it.
Well, oh my gosh, Barry, we are at the end of time. We will certainly have you back for the 9th time. I'm sure, next year, if not before. But I'd like to thank you again, Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, about all of your wonderful Medicare 2025 updates. I'd like to thank everyone who listened and joined us. You're listening to Project Independence and You on LIU Public Radio.